Hello everyone, welcome to my channel. This topic is related to medical surgical nursing, eye disorders. This topic is glaucoma. Glaucoma, whose chief feature is increase in the intraocular pressure. How is there an increment in intraocular pressure and how it can be managed? We will discuss in the video. Introduction of glaucoma. Glaucoma is a group of disorders which is characterized by increased intraocular pressure, optic nerve atrophy, and peripheral visual field loss. So, glaucoma is a group of symptoms, group of disorders in which there is increased intraocular pressure, pressure of the fluid inside the eye, optic nerve atrophy, tissue level destruction of optic nerve, and peripheral visual field loss. That means gradual loss of peripheral vision. Some data about glaucoma. Glaucoma is the leading cause of irreversible blindness worldwide, also in Asia and also in India, Nepal. More than 1 million cases of glaucoma per year has been recorded in India. A picture of glaucoma. Due to increased intraocular pressure, it damages the optic nerve, and what happens is the perception of vision cannot reach up to the brain. That is why there is gradual loss of vision and irreversible vision loss. Etiology can be, first of all, increment in intraocular pressure, imbalance between rate of aqueous humor production and aqueous humor reabsorption by the eye, and also intraocular pressure remaining elevated. Normal intraocular pressure can be 10 to 21 mm of Hg. If it raises above 21, we can call it raise or increment in the intraocular pressure. Risk factor for glaucoma can be, first of all, age. As the age advances, due to degeneration in tissues, many of the disease can occur. Body becomes susceptible to many of the disease. Glaucoma can be one of them. Next is race. In some races, the cases of glaucoma are found more because of genetic makeup. Next is family history of glaucoma. If there is presence of glaucoma in immediate family, there are high chances that glaucoma can be present in such patients. Next is disease like diabetes mellitus, cardiovascular disease. Disease like this, systemic disease, can get complicated and disturb the metabolism of the body. Disturbance of metabolism creates an increment or decrement of pressure somewhere. Intraocular pressure can be one of them. Next is trauma and injury of eye. Anything hits the eye with higher pressure than normal, then eye can face trauma and injury. There is also a drug-related risk factor, that is prolonged use of corticosteroids. Corticosteroids is a hormonal medicine used for treatment of numerous diseases. Prolonged and continuous use of corticosteroids can also lead in increment of intraocular pressure. Pathophysiology for glaucoma can be, first of all, increase in intraocular pressure due to risk factors. Because of raising of intraocular pressure, there is increased pressure on bulbar wall of neuron. This is the same neuron that reaches towards the brain. Then there is resistance to lamina, which is increased. That means the surface of the eye that passes the nerves to the brain becomes resistant to pressure. That is why there is a damage to the axons of the nerve. And finally, there is optic neuropathy. That means the channel of communication between eye and brain breaks down. This is the reason of vision loss. Types of glaucoma. There are two types of glaucoma, open angle glaucoma and angle closure glaucoma. In open angle glaucoma, it is usually bilateral, occurs in both eyes, but one eye may be severely affected than the another. There is a possibility of ocular pain and mild headache. Intraocular pressure rises above 21 mm of Hg, and also optic nerve damage might occur. In angle closure glaucoma, there is obstruction in aqueous humor outflow. Due to that obstruction, there is rise in intraocular pressure. Some other features can be there is a rapidly progressive visual impairment, periocular pain, that means around the ocular muscles, pain occurs, conjunctival hyperemia, excess blood supply to conjunctiva, and congestion. Congestion is when a little space has too much of particles. Little space has too much of fluid. Next is blurring of vision. There is blurring of vision and halos around the light. Halos formed when eye is exposed to light. There is also ocular pain and headache. Clinical features of glaucoma can be, let's see this type wise. First of all, open angle glaucoma. There is a loss of peripheral vision due to compression of retinal rods and nerve fibers. Halos around the light as a result of corneal edema. Cornea undergoes edema, that's why there is halos around the light. Mild ache in the eye caused by increased intraocular pressure. Reduced visual acuity, especially during night, which is not correctable by glasses. In angle closure glaucoma, features can be inflammation and redness in the eye. This was not present in the open angle glaucoma. Sensation of pressure over eye due to increased intraocular pressure. Moderate capillary dilation non-reactive to light. Cloudy cornea due to compression of intraocular components. Decreased visual acuity due to aberrant neural conduction. Photophobia due to abnormal intraocular pressure. Photophobia is sensitivity to the light. Halos around the light, and some minor signs and symptoms can be nausea and vomiting because there is increased level of intraocular pressure. This sensation of pressure over the eye can be felt from outside. Diagnostic test for glaucoma can be, first of all, history, because this is related to previous eye surgery, previous systemic disease as we learned back in etiology, or family history. In physical examination, patients who are suffering from signs and symptoms, if we do physical examination on them, there can be swelling of eyelids and blurring of vision. We can also perform visual acuity examination, tonometry. Tonometry can be used to measure the intraocular pressure. Ophthalmoscopy, to visualize each and every organ of the eye. Slit lamp examination, again, visualization of each and every organ microscopically, so that if there is bleeding from any side, if there is a tumor, if there is anything that is aggravating this glaucoma, can be easily found out through slit lamp examination. Medical management can be any kind of drug that helps to reduce intraocular pressure. First of all, beta blockers. They can be used to reduce intraocular pressure. Alpha adrenergic agonists, cholinergic agents, carbonic anhydrase, prostaglandins, or drug like mannitol. They all have their own drug, own doses that one way or the other helps to reduce intraocular pressure. Surgical management, first of all, can be argon laser trabeculoplasty by using laser, argon laser. Trabecular meshwork can be repaired. There is an insertion made from outside that reaches up to trabecular meshwork, and trabecular meshwork is repaired, which reduces the intraocular pressure. IOP is intraocular pressure. Next is a laser iridotomy. Now, by using laser, some of the portion of trabecular meshwork can be removed for pupillary block glaucoma. So, an opening is made on the iris to eliminate the pupillary block. Trabeculectomy is next. This is a removal of some portion of trabecular meshwork so that the normal working trabecular meshwork can function properly. Next surgery can be drainage implant or shunt. In this, we can create an opening nearby the eye, and then All the excess fluid that is creating excess pressure can be drained outside through that opening. Next surgery can be trabeculotomy. This surgery helps to stabilize the optic nerve and minimize the further visual field damage. Trabeculotomy is also done through an incision made at the eye wall just to stabilize the nerve. The nerve message which was not conducted properly can be stabilized through this surgery. Nursing diagnosis for this disease can be, first of all, related to acute pain. Nurses can help in changing position. Nurses can help in distraction therapy. Nurses can help to, placing the call bells whenever they need the nurse for pain. Another is disturbed sensory perception. Again, for disturbed sensory perception, nurse can assist in orientation to the environment. Nurse can assist in performing daily basic activities. For self-care deficit, nurse can involve the family members in the patient care, especially when they are old age patients. Also, nurse can therapeutically treat the patient in such a way with dignity that patient does not feel self-care deficit or patient does not have a feeling of low self-esteem due to their decreased vision. Potential nursing diagnosis can be injury. So there is a risk of injury related to decreased vision. For this also, someone should be always there to help the patient while movement and placement of call bells, of course, near the bed, at the reach of patient. Nursing management will be discussed at the end after completion of every topic of this disorders. So we will discuss all these nursing diagnosis again in that video. Complications of glaucoma can be, first of all, blindness. As we discussed at the initial point of this topic, glaucoma can be the cause of irreversible blindness. So the main complication is blindness and then reduced peripheral vision. If not blindness, glaucoma can lead a person to reduced peripheral vision. Thank you so much. Next disease will be discussed in next video.